Hi, my name is Bill Snyder, and I'm a DJ at Alt 92.5 The Sierrawave in Bishop, California. The world, our world, has been turned upside down suddenly by the COVID-19 coronavirus. There is a lot of information floating around about the COVID-19 virus. Unfortunately, some of this information contradicts other information that we have heard, and some of it is dangerously false. So what are we to do? Well, in keeping with the legacy of news and information that the Sierrawave has at its foundation, we are presenting the second in a series of interviews with experts on the COVID-19 virus. Today, we present two doctors from Northern Inyo Hospital in Bishop, Dr. Wakamiya and Dr. Samantha Jeppson. Dr. Wakamiya specializes in caring for the most vulnerable among us during this time of disease and uncertainty, those people being the elderly in our community. Dr. Jeppson, well, she's on the front line of this healthcare battle as she's an emergency room physician. So take a few minutes, watch this video, and replace some of the misinformation and the subsequent fear that you may have with the peace of mind that can only come from accurate facts and information. Information that may save the lives of your friends, your family, or perhaps even your life. So here are Drs. Wakamiya and Dr. Samantha Jeppson from Northern Inyo Hospital.
So, hello, thanks for having us here today. My name is Wakamiya, and I'm an internist and a geriatrician practicing at Northern Inyo Healthcare District.
And my name is Dr. Jeppson. I'm one of the emergency room physicians at Northern Inyo Hospital.
And we're here today. We're going to take about 20 minutes to talk to you about COVID-19, about some of the practices that are being encouraged right now, including social distancing, and about how you can keep yourself and your loved ones healthy, and about some other updates in the community right now.
So as most of you have heard, there is a virus going around called coronavirus, also known as COVID-19 once you have the disease itself. And it's been spreading pretty quickly in the United States. And as of now, we do not have any confirmed cases in Inyo or Mono County. But that is widely due to the fact that we have been limited on the amount of testing and the results themselves. So we haven't had a positive test, but have not been able to test as widely as we would like to. And so it's safest to assume that it is here and to act accordingly.
Yeah, and that's why we're really encouraging people to adopt the policy of social distancing. So what does social distancing mean? That means really putting as much space between you and other people as possible. So, of course, there's people in your household that you're going to be coming into contact with on a daily basis, and people in the workplace as well. But limiting the size of your gatherings, limiting your interactions with people outside of your household, people that you don't know what exposures that they've had and who they've been in contact with and where they've been traveling. And the goal of this is to decrease the chances of the virus being transmitted. Now, going back to the coronavirus, we know that it's transmitted through sneezing, coughing, touching, sharing food. So close contact and kind of longer duration of being in close contact. And we also think that it's possible that you can inhale small particles of the virus in aerosolized form, although this is still a little bit controversial. And so because of this, keeping the social distance and limiting your contacts as much as possible is really important to limit disease spread. And the social distancing is really important as well, because right now testing has been very limited in the United States. The turnaround time on testing has also been really long, so up to 5 to 7 days to get test results back. This is a problem that has been pervasive throughout the United States, not just in Inyo County. The problem that this presents is that we may not have an accurate we might not have an accurate picture of coronavirus presence in the community. And based on what we know about what's going on in other parts of California, and what we know about travelers coming through Inyo County and the Bishop area, I think it's probably safe to assume that there is coronavirus in this area. And what social distancing does is it helps us slow the spread of the virus. And for the reasons why we want to slow the spread of the virus, one is so that if the virus spreads very quickly, it's possible that many people could become sick at the same time, requiring our resources, our healthcare resources. And if a lot of people become sick at the same time, the hospital could become overwhelmed, and we might have more difficulty caring for the people who need hospitalization and ICU level care, even life support. If we practice social distancing and staying at home, we are able to slow the spread of the virus and decrease the transmission speed of the virus. And that will buy us time in order to be able to care for people who do get sick, so that our healthcare system is less overwhelmed, so that we have a less of a spike in cases, and also over time, less cases overall. That's one goal of social distancing. I also think another goal of social distancing, because we don't have the testing available to us right now, social distancing helps us, even if we don't know the coronavirus is here in Bishop and in Inyo County, we can kind of presumptively stop the spread while we don't know. And it buys us time while we're waiting for the testing. According to the government, according to what we hear in the media, we should have more testing capabilities in the days and weeks to come. We should be able to widely test with much quicker turnaround times. And social isolation and social distancing slows the virus transmission to buy us time to get to where we have adequate testing. Our healthcare district is doing all that it can right now to test people who have symptoms, but it's been a national shortage and a national problem for testing turnaround times.
And as some of you have probably heard, there are certain populations that are more vulnerable to this virus, and Anne will talk about that more. And I think it's easy for people who are otherwise young and healthy to not feel like this is their problem as much. But I think the importance in taking that accountability is understanding that by social distancing, you are then preventing yourself from becoming infected, and then passing that along to people who are at risk and will be severely affected by it. So it is really important to take that accountability. And as much as it isn't that fun to not be around your friends and not go do what you want to, it's really important that we ascribe to that right now to protect each other.
We know from some of the data from China, South Korea, and Italy that it could be up to 80% of people who have coronavirus don't have symptoms, but they are vectors for transmission. The people who don't have symptoms, so they can spread it to people who will develop symptoms and really severe illness. And so, the social distancing is really to protect people who are more vulnerable.
And some of those symptoms they can be anywhere in young and healthy people to just having a bad cold. And for people who it affects more severely, it does present mostly with cough and shortness of breath. And then in about half of those, it's fever. And then in a lower percentage, it's more headache, body aches, kind of flu-like illness.
The really vulnerable population is the older population, and we know that from the data coming in from other countries. The mortality rates in adults, as you can go above 60 into the 70s and 80s and above 80, we know that increases. And in people above 80, the mortality rates have been seen between 10 and 15%. So we know that older people are more susceptible to severe cases of COVID-19. In addition to age, other risk factors are underlying medical conditions such as diabetes and high blood pressure or other heart or lung disease. So the social distancing really among the younger people, and as we've seen, our schools have been closing, gyms have been closing, restaurants and bars, and which has really limited a lot of gathering of younger adults and a lot of younger adults, and this is really to prevent the spread to our older and more vulnerable populations. And so I think a lot of people ask, should I isolate even from family, or how about from friends? And I think one thing to ask is where, I think is kind of where have your family and friends been traveling, and what do their daily routines look like? And I think households that themselves are isolating and there's consistent interaction between those households, whether it be grandparents, or friends, if they have been isolating as well and they haven't been traveling, some minimal necessary contact is likely okay. But if you're not sure where your friends or your family have been traveling and you're not able to control and know about the exposures that they're having, it's best to avoid that contact and to practice social distancing in those situations. So maybe just a quick update on our community. So we do, one of our most vulnerable populations in Bishop is the Bishop Care Center. And so the Bishop Care Center is taking a lot of steps to prevent coronavirus infection there. At this time, unfortunately, there are no visitors permitted into the building and no non-essential staff in the building. So this is, and residents have not been able to congregate for eating meals and also for activities. And it's extremely hard for the residents because I think that the contact with their friends and families is so important, and with each other. So it's been a very difficult time. But this is the kind of protection of this community has been so important in order to limit their exposure to coronavirus. A few other updates from the community that I wanted to convey. One is as of midday today, Dwayne's Pharmacy has not had shortages of medications. And so we encourage you to fill your medications on time. I don't think there's a need to oversupply your medications and overstock your medications, but do have medications on hand that you might need for the next 2 to 4 weeks. Make sure you do your refills on time and not get to the last doses of your medications. Also, I know in the past our healthcare district and our hospital has been able to provide masks to those who have respiratory infections, but at this time the hospital is unable to hand out masks to the community, and that's in order to preserve the protective equipment for our healthcare workers and for our staff. And then the other point I wanted to convey is that I know there's a lot of people who are getting their are due for annual labs or an annual examination. And if you're feeling well and your labs are for a routine purpose and for an annual checkup, we're asking people to hold off on getting those labs for the moment and, maybe wait a month or two and reassess at that time, whether that's the right time. And this is particularly for our population over 65. Again, we really want to limit the exposure that you're having to any possible coronavirus.
So what happens if you are having symptoms? Which, include if you're having fever, cough, or feeling short of breath, or feeling like you have the flu. The safest thing right now to do is during business hours, actually just call the rural health clinic to talk to a provider about whether physically presenting for testing is warranted. And during after business hours, you can call the emergency department to do the same thing, because to be honest, at least in the emergency department, showing up unless you really need to is actually more dangerous, because that's a spot where you could be exposed to infection or expose other people to the infection that you do have. So we're really trying to be thoughtful about who is presenting to the emergency department. So you can call and talk to someone about your symptoms and decide if it does make sense for you to be seen physically. And if you are feeling very short of breath, in respiratory distress, obviously that is when you need to be seen immediately. But otherwise, we're hoping that if you're not in that state, you can continue to treat yourself at home as you would by treating your fevers, staying well hydrated, continuing to wash your hands frequently, and avoid contact with other people.
So if you're doing okay and and it's not an emergency where you're feeling emergently short of breath, please call your primary care physician for further instructions on where to go for evaluation.
Another thing we wanted to talk about is there's going to be in the hospital-wide and then in the emergency department itself implemented a new visitor policy, which is unfortunately no visitors are going to be allowed unless you're coming with a pediatric patient. And at that point, only one parent will be allowed back, and no visitors in the waiting room. We're asking that people will wait in their cars. Again, just trying to prevent the spread, prevent healthcare workers from becoming infected and whatnot. So those are kind of the big changes that are happening in the hospital right now.
The visitor policy has been in development over the last couple of days, and what we're doing is we're differentiating between visitors and a support person. So for pediatric patients or patients who may not be able to speak on their own behalf, or patients who may be imminently dying, they will be permitted to have a support person at their side. And also for labor and delivery. The visitors, we're doing our best to protect the people who are hospitalized as well as our medical staff from transmitting infection.
Yeah, so I think just to kind of re-emphasize doing what you can to minimize your contact with other people. And so, go to the grocery store to get some food for the next week or two, just to minimize having to go back out in public is probably the safest thing to do right now for yourself and for our community. And we're just really trying to prevent our system from becoming overwhelmed. And so any part that you can play in that will be much appreciated.
And the good news is that we know social distancing is effective in reducing transmission. And so it's a positive step that we're doing this right now. And it's the right step to protect our community. In sum, I think the two messages today are continue to practice social distancing. This is the most important thing you can do right now. Stay at home with your friend, stay at home with your, you might have to edit that one. In sum, the most important thing that we encourage you to do right now is practice social distancing. Stay at home, stay with your immediate family and your household, and limit your contact with other people. Go to the store and the pharmacy, the grocery store and the pharmacy only when necessary, and really hold back right now from taking trips to other places, whether it be traveling out of the county or whether it be visiting other places, even in town. Really, the grocery store and the pharmacy, and if you need it, to the hospital. But otherwise, we really encourage you to stay at home.
And feel free to call the rural health clinic or the emergency department after hours to discuss symptoms if you're having them, and to decide if being seen is appropriate at that time. And the other important message is, if you are having any symptoms or any questions, to attempt to get a hold of your primary care doctor during regular hours to discuss if whether being seen at that time is appropriate. And after hours, feel free to call the rural health clinic or the emergency department to discuss your symptoms with someone before presenting physically.